If you're seeing this video, you've likely seen our other video or heard from us regarding keratoconus and corneal cross-linking in general. To review, we know keratoconus is a disease of the cornea. We know it's progressive, featuring thinning and bulging of the cornea, often leading to a corneal transplant. Ectasia is a similar disease that occurs after laser vision correction. And I'll be talking about keratoconus, referencing both keratoconus and ectasia. Corneal cross-linking uses ribo drops and a special soft yellow-green light, and has been very effective at making cornea stronger. It stops progression and almost always eliminates the need for corneal transplant. There's been over 10 years of international experience, and the FDA approved corneal cross-linking at the end of 2016. It's now clearly standard of care for treatment for the progressive keratoconus and any ectasia patients. We were involved in the FDA trials that led to approval, and we now offer the FDA-approved Avedro treatment, which I'll call Avedro treatment in this video. We also offer a newer FDA study that I'll call study treatment in this video, and we believe both work really well with over 99% success. They both use the same overall technique of riboflavin drops and a light treatment, but there are differences between the two, and I'll cover a lot more details, but here's the summary. They both work with excellent results, with approximately 99% success for both. Study treatment has easier, quicker healing with less complications. So let's go through how these two treatments differ and how they're the same. Avedro and study are similar and different. We'll look at who's a candidate for each treatment, the surgery itself, post-op details, results, complications, costs, insurance coverage. So let's get started. Who's a candidate? Most patients who have progressive keratoconus or any ectasia are candidates for either treatment. We've had a lot of experience with both, with over 99% success for both. And we believe both treatments work exceptionally well. The surgery, although both treatments take a long time, 2 to 3 hours to do both eyes, both are relatively easy to get through. There are, however, some significant differences. The study uses different formulated riboflavin drops, different preparation of the cornea, different light intensity, and different timing of the light itself. It's important to note the Avedro treatment can be performed at any one of our Woolfson Eye locations, while the study treatment has to be done in Sandy Springs in Atlanta, our main office. The Avedro treatment requires removal of most of the surface epithelial cells on the cornea, while the study treatment keeps those cells intact. This impacts the healing in a significant way. Post-ops. The study treatment requires all pre-op evaluation, surgery, as well as all post-ops have to be done in our Sandy Springs office in Atlanta. Most study patients see us at day 1 and then 3 months later, and then at month 6 and 12. For Avedro patients, the FDA-approved treatment, they can have their post-ops done at any qualified doctor's office. The results. After having done well over 1,000 treatments, we're happy to report both treatments work really, really well. In rare cases, we've seen improvement in the corneal shape and also with the vision. The end results are excellent and approximately the same. Complications. Although rare, complications are possible. Avedro treatment eyes are much more likely to experience complications such as infection, delayed healing, corneal melts, haze, or scarring. These are very rare and we don't expect them. With our study patients, we haven't had any of these. Financially, it's been complicated. Insurance company coverage is possible for Avedro patients only. Because it's FDA approved, insurance coverage is becoming more common, as insurance companies acknowledge its standard of care. but Avedro is more expensive, which is a big deal if the insurance company doesn't cover it. And also there may be issues with high deductibles, and the insurance coverage is not automatic or easy. At this time, study patients, it's less expensive but no insurance coverage at all because it's a study. So overall, as I said, the financial part is complicated and it's changing rapidly. And we'll have our financial team work with you to help make the best decision for you. So that's the overview. Both procedures work great. Study treatment has easier, quicker healing with less complications. The financial considerations are complex, and we do have specific paperwork that will help you understand this more. So thanks for listening to this. I'm sure you'll have questions, and we're eager to discuss those with you. Let's use this chart to review what we've just discussed. This chart covers patients who are candidates for cross-linking treatment. It's a comparison of the Avedro treatment and the study treatment. Remember, this is to treat progressive keratoconus and ectasia patients. Nearly all progressive keratoconus patients and all ectasia patients qualify for one of these treatments. So on the chart, we see candidacy. Both Avedro and study patients, all of these patients are going to be candidates for either of the treatments. The surgery itself, Avedro treatment, we're removing the epithelium, which means much tougher healing. It's more painful and takes longer. And the surgery itself takes 2 to 3 hours. For the study patients, we keep those surface epithelial cells intact, which makes it easier for the healing with less complications. And the surgery itself takes a lot less time. We say up to 2 hours, but it's often less than that. Pre-op locations. For the Avedro treatment, we can do all these pre-ops at any of our Woolfson Eye locations. For the study treatment, the FDA limits us to doing the study only in our Sandy Springs, Atlanta location. For post-ops, again, the Avedro treatment, we can see these patients at any of our Woolfson Eye locations or at a referring doctor's office. For the study patients, we need to see those patients in Sandy Springs only. Pain, there is a significant difference between the two. For Avedro patients, there's significant pain and blurriness for about 4 or 5 days, but for study patients, there's only moderate pain for about 1 day. Results are similar. Both stop the progression, approximately 99+% of the time. Not a big difference there. Complications we discussed briefly earlier, related to removal of the epithelium. The Avedro, you take the epi off, so there's more complications. With the study patients, it's very, very rare to have any significant complications there. For financial considerations, it is complex. For cash-paying patients, the Avedro patients, it's around $5,500 per eye. Study patients, it's around $3,000 per eye. But there are differences also in the insurance coverage. Avedro patients, insurance may cover it, while with study patients, insurance is not going to cover it at all. Age considerations. For the study patients, we can treat patients as young as 8 years old with no max. And for the Avedro patients, the minimum is 14 years old. For study patients, there really is a lot more flexibility. We don't have to prove progression of the disease, which we do have to do with Avedro patients. Also, we can do bilateral treatments a whole lot easier with these study patients. And also with the study, we can treat patients that have thinner corneas and more progressed disease. With the Avedro treatment, we cannot treat these patients. Overall, most patients choose the study option, but it's a personal choice. And the factors, especially the insurance coverage, are changing. We'll be happy to give you all the information that you need to help you make the best decision for you. It will take as much time as we need. Thanks for listening to all this information. I know it's a lot of information we've been giving you, and we look forward to seeing you and answering any questions you may have.